Uh, Again, thanks for the invitation. I'm delighted to be here. And I'm, of course, the psychiatrist here. And in fact, that's probably very appropriate because this is a sociocultural, psychological phenomenon. And the fact that we're even talking about using medicine to solve it, I'm trying to remember, there's a kind of a joke of the guy looking for his wallet. He lost his wallet. And somebody said, well, you lost it down the street. Why aren't you looking down there? He said, well, here's where the light is. That the real issue is down there. I thought of coming up here and like, why am I here? I think I'm here for two reasons. One, I have a commitment to the idea that parents, children need help, and they're not getting help because of this phenomenon. And I'm not going to use the word abuse, but I want you to think about for a few brief moments the idea of neglect and give you some examples of why this is a neglectful phenomenon, neglecting the developmental needs of children. And I'm also here because I think truth matters. And Michelle and Paul have been clear about things that are just not true, and there are a number of things that are just not true in this sociological phenomenon. So I've testified in a number of cases over the last several years as this thing has just mushroomed. And one of the declarations I read, the physician said this: the cost of not assigning sex is dire. It is counter to medical science to use chromosomes, hormones, internal reproductive organs, external genitalia, secondary sex characteristics to override gender identity for the purposes of classifying someone as male or female. Gender identity should control when there is a need to classify an individual. I was stunned when I read that. Counter to medical science, chromosomes, anatomy, physiology, genetics. This is medical science. That's how we categorize things. But that should take second place to this feeling, this notion of gender identity. Unbelievable. Can we cue up that video? Somebody here? Take a look at this and enjoy it. It's about a minute.
ABCs. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W,
All right, so why did I show that apart from my grandfather's narcissism? That was my, that was my son you heard, who actually just worked a number of years down at DOJ here for 6 years. He's now in Georgia. But this child waited for the father to prompt her, 20 months of age, at every point. She didn't have any idea of what she should be saying, except he told her, B, C, D. And this is what parents do. So it's impossible to speak about gender identity without thinking of the parent-child relationship. When you think of it, children don't know much about anything. And I say with this respect. I've raised 3, I love them dearly, they're doing well now in their lives, but they don't know anything. So at the age of 7 or 8 or 9, well, why should we listen to a 9-year-old about time they're going to go to bed? We don't let them vote, we don't let them drive. And so we're going to let them, at the age of 8 or 9, decide that they're no longer a male or female. Unbelievable, unbelievable. And we don't allow children to do this. And in fact, this boy, the young man who's giving direction there, when he was 8 years old, he said, I'm going to be in the NBA, so I don't need to go to school anymore. and his mother said, well, you need to go. And then he countered. He was a tough kid. Well, I've already gone 3 years. we made them go to school. And of course we chuckle because but that's the amazing neglect of the need for child development. So neglecting that, and when parents abandon being parents, then we're in a lot of trouble. So this notion, and Michelle's already mentioned it, the persistent, consistent, insistent way that a child expresses that I'm a male or female, that is proof that it's true. How many people here have children, by the way? All right, so half the group. Well, you all know that children persistently, consistently, insistently demand lots of things that aren't good for them, that are bad for them, and they resist what is good for them. Time to go to bed, turn off the computer. The child says, well, that's a good idea, Mother. I was actually thinking of that. It's part of normal development to resist change, and it's part of the parent's job description to do this. Children's experience in life is limited. And so that's what needs to happen. And that's what's missing, a core part of this in the transgender business. In addition to guidance, children need structure. A friend of mine did a lot of camp work. He was actually a philosopher. Right? He was a very thoughtful guy. But he did an experiment once. He had a bunch of 10, 12-year-old kids on a hike and said, isn't this great? We can go wherever we want. We can jump over a creek. We can climb a tree. We can throw stones. There's no stop signs telling us. It's just great. And the children enjoyed that kind of idea. Later on in the day, what happened? As the sun began to set, one of the kids came up, unbeknownst to the others. You do know how to get home, don't you? The children panic without guidance and structure. They also need the instruction, so the truth of the facts of life. Chandler here needs to know her ABCs at some point, and it's a gift of parents to give her that. Briefly, transgender ideology also is neglectful of the need for developing coping skills and problem-solving skills in children. I want you to think of pain for a minute, and pain in a generic sense of distress. When doctors see pain or distress, what do? We try to figure out the cause of it and map out a treatment. We don't ignore it. We don't walk away from it. We ask questions: where does it hurt? How does it hurt? What makes it better? And so forth. And when that kind of questioning is not being asked, in fact, it's off the limits in some legal attempts have been made to crush that, we're abandoning children. We're neglecting a potential diagnosis. And it's not uncommon in the movement, and I will call it a movement, right? To hear it's incredibly harmful to have these children go into the bathroom of their genetic sex. It's just too stressful. Well, in the process of development, we're always subjected to some kind of stress in developmental crises. There's not a person here in this room who would be here otherwise, I'm sure, if they ignored some of these developmental challenges, which were difficult. All-nighters in college, studying something that you didn't understand, grappling with courses that you didn't want to take but had to take. It's part of development. But with these children, when they have, I'm uncomfortable, that's all it takes, we walk away from them and abandon them. And if we ignore pain, the bottom line is that we might miss a diagnosis and a chance for developmental progress. Now, the activism that's out there also prevents us from diagnosing accurately. As Paul mentioned, depression, anxiety, substance abuse, it's abundantly clear that these youth have multiple more psychiatric problems than other patients. Controlled studies have shown that, even more than other LGBT patients. And why is this? Well, we need to explore it. A recent patient that I saw really 2 weeks ago told me she was a genetic female, but she wanted to be called Matt. Her name was Madeline. She said, I identified as a male at 12. I was so much more comfortable with that. Again, that word, avoiding distress, avoid discomfort. Treatment paradigms just can't do that these days. But so much more bad stuff happened when I was called Madeline. She was abused badly. It was horrible. I didn't want anything to do with that person and what had happened to me. And there are dynamics of all these kids, these adolescents who are in difficulty, almost all of them. So I said, have you talked to anybody about this? Have you ever talked to a professional about this? And she said, no. I simply said, well, would you like to? She said, well, now is probably a pretty good time. It was actually exquisite but elegant in its simplicity. Any good therapist behaves that way, but in this area, it's hands off. It was just a simple question. Have you ever talked to anybody about that? And she hadn't. And so we've continued to do some therapy. A comment briefly about the stigma, and I know we've got to end here. Stigma is not enough to explain all the mental health problems. It's not a unitary hypothesis that explains everything. And that's the only thing that can be said by, if you will, the other side. I have deep concerns about families who struggle. They're getting this message, and what is the message? We could all say it in unison. If your child comes home with this, Mom, I think I'm a boy, kind of thing, you affirm her. What? Of course you affirm the child and love the child, but you don't affirm a bad idea. But that's what's being said. And one of the therapists in the clinic that I directed said, I don't need to judge this boy. My response to her internally, and she and I are working through this, but was absolutely you judge, not in a moral sense, but make a clinical judgment, a judicious judgment of what is going on, and why would someone come up with this idea? I will end with this, that there's a strong move to push gender dysphoria out of the mental disorders nomenclature in psychiatry. And it's very powerful. Activists believe that having it there, of course, creates prejudice. And we've had precedent in psychiatry. Get rid of the diagnosis and you get rid of the prejudice. We're all normal. But it was left there because the patients needed what's called access to care, read insurance. They needed to get that insurance. And in order to get that, they needed a diagnosis. But they're still trying to get it out of mental disorders and placed into another category, and the World Health Organization is working on their ICD-11, it's called, to try to get into a medical diagnosis. So we'll end with this, to follow the tortured logic. And there's no area of medicine and really psychology, human development, that has this tortured logic as this one. We do not want it to be a mental disorder, but we need it to be a mental disorder to get treatment service access. But then, what are we getting access for when it's not even a disorder to be treated? Just think about that logic. Which makes sense. Why would you have insurance coverage for something that's not a disorder, which is where it's headed? But then the only disorder that's left is the stigma and shame and embarrassment that you've created. When I say you, meaning culture. We've created that in them. Tortured logic. And that has really been an overriding principle of all the things that you've heard here.